Baker, for being with us today. When do we need to see a neurosurgeon and not just the ibuprofen cabinet for a headache?
Well, for vast majority of the headaches, they're benign, and they can be treated with ibuprofen or ibuprofen-like medications. But there are a few conditions where a neurosurgeon's involvement is critical. Typically, I would classify them into two different categories. One that is insidious onset headache that sort of comes on gradually but only gets worse over time. That can be caused due to a slow-growing tumor. It could be caused due to a cyst that is sort of expanding, or any other mass lesion that is occupying space where they don't belong, which is the brain. And so if that's the case, then obviously the doctor would be ordering an MRI confirming that that's a condition, and they'd be referring the patient to me to either resect the mass or observe the mass. On the second category, it's somewhat emergent. That means all of a sudden you have the worst headache of your life. That could be an underlying vascular malformation, like a brain aneurysm that is ruptured, so it's an emergency. And also, rarely, some patients who are in their postpartum period have significant headache. It can compress their optic nerve, which can make them blind. So emergent decompression of that bleed is critical to regain or maintain neurologic function.
Yeah, that sounds serious for sure. And quickly, can you explain the surgical